Good morning. This is Dr. Bill Wyatt again with the American Orthodontic Society. And, I want to do a little video to just explain how these bonded blocks, if you aren't used to using these bonded blocks, you can do a lot of different things. It affects the way the teeth close together and the pressure is on the jaw at certain points, and what you take the pressure off of the condyles back here at the back if you're having trouble with that. And it's just a lot to understand about this. And I wonder, I've been doing this for 60 some odd years, and I'm beginning to really understand it, I think. I'm sure there'll be much that I have not thought of that you'll learn in the future, but I've been doing it a long time. And these bonded blocks have a lot of places that you could use them, and I want to talk to that about today and tell you some things about it. I'll have to get this going. Now this young man that I'm going to use his models and everything to show you how we make these bonded blocks. It's easy to make, and we make them with just regular acrylic. I'll show you the kind of acrylic and everything that we have. And when this guy closed together, well, of course, these front teeth would be down here. Now we open him up about this much, and we've got these bonded blocks over on this particular, on the left side of the mouth. Now, if you take this out, these front teeth would go down to here, and the bottom front teeth would come up way up in the top of the mouth, right up here. And these are gadgets and devices that we make to learn how to adjust and work with the things that we are presented with. The human body and the body all over is just fantastic. It is something that is unreal. I mean, how it's made like that. So let's get into this now. And I want to try to talk to you some about this. Well, I've got this virus, and that's making me very hoarse in here. The body's trying to cope with it. I feel fine and everything, but my lungs have a problem with that. So and a lot of people are that way. So that won't bother us, no. All right, we take somebody that we put their teeth together, and their upper teeth come way down to here, but they catch the jaw right here and hold it back, and the jaw can't come out here because these front teeth close here when you chew. And so the jaw wants to move in a forward direction here, but it can't because of the teeth holding it off here. So we're going to do some things to help bring the teeth back to a more normal position in here, and let this bottom jaw come out and follow them, so that these teeth right here, the lower teeth, need to be out with this this point right here will come down in there. The lower teeth will be protruding further forward out here, and this gets the condyle back in here that's in the fossa, and it relieves the fossa. A lot of times the jaw can't come out. This condyle is messing with the retrodiscal tissue back here and giving trouble. It wasn't in this particular case, but if we bring the jaw forward a little bit, then the condyle will move out in this area. Then this will have to change a little bit where it meets back in the back. Okay, let's get on with this, and I want to show you how to make the block. It's real simple, but it really helps you out in a lot of different situations. Now on the other side, we're just showing you on the model how we make this. You put it on an articulator, but you don't do that. We just put it in their mouth and have them close to it, position that you want them to be in, and make an indentation into this wax that we have. Now, how did we get the wax up like that? I'm going to show you that again too. Let's go ahead with this. Now here, this is not in focus good, but this is a acrylic that we use, or you don't have to use any fancy acrylic. Just don't build these blocks out of some good composite material. I made some out of a real good, strong composite, and you couldn't get them off the teeth. You know, it took me 2 or 3 hours to grind this stuff away from the teeth after I screwed up there and used the wrong thing. Just plain acrylic, lab acrylic. It works fine with it, and you need a little petri dish or something to mix it in. Here's a glass one over here, a little rubber one that we use, and we put the powder into one of these deals, and then we drip liquid in there until we get it just the liquid and all the acrylic that's in that little bottle deal. Now there's the acrylic. We're putting it in to this little rubber deal, and we'll fill it up to about here, somewhere like that. And then I want to put the liquid in there. Now there we take, we heavily drip the liquid into this area and mix it with this acrylic. And now each time when you're using this, bonding it to the teeth, you've got to go back to the teeth and get an etching material, and you put a little cotton on the end of some tweezers, and you dip this kind of acid, and you go on the occlusal surface of the teeth with it. You put some of that on that cotton, and now we just take that cotton and go along and dip it around on the occlusal surface of these teeth. And this etches the teeth to just a very small amount, but it makes the tooth, it cleans it up and everything, and it etches, and there's little pores in there that allow this acrylic to join onto these teeth, where it'll stay there for a few months or something like that, where you're working with it, and then we can come back, and the acrylic is just be a hump and back in it. You bite down on that, and then you trim it, and just have the cuspal points from the upper teeth in that, and it's bonded to the lower teeth down here. Now we use bands on the 6th and the 2nd molars back here. We have buttons, and we put these little O-rings on to keep from irritating the tongue, and that. And then we take this off. We have to let this come together out on the bottom. Now let's go to the next slide here. All right, here we are. We put this acrylic powder in here, and now we drip this liquid that is going to react with the powder and form the acrylic itself. And now we have it moist in there and everything, and we'll mess with this, and this will get kind of hard. We come back over and wash and dry this acid etch material off of the crowns of the teeth in here, and clean that all up and get it good and dry. And now we're going to put a liquid that is chemically acceptable to the acrylic that you're using, and it'll bond these blocks to these teeth right in here. It sounds, once you get to doing it, it's real simple. It's really nothing to it. All right, so here we dip this brush into that, and I'm going to come in on these teeth that have been etched and washed, dried, and we put the liquid in there, liquid in the acrylic, and it worked that down into these teeth, and this causes this acrylic joins the other acrylic, and this part is down in the little pores that we have created with the etching material. All right, here is just looking at this jar. This looks awful big, but we're going to peel this acrylic out of this little jar-like device, with a rubber device we've got. So I'll go around it with a spatula and loosen it up, and then I've got a chunk of this acrylic. This is the acrylic now that's soft. It hasn't set up yet. It's going to set up over time. And we mold that into a deal that's something about the size of a pencil, and you make it whatever distance you want, and you take this and mash it between your fingers. You can, this is, of course, you'd have gloves and everything nowadays on here, and now we'll moisten one side of that, and we take it with this brush and put some liquid on this acrylic, and now we come in and set that acrylic pad on top of these teeth right here, and we have already put Vaseline or some sort of a separating media on the upper teeth so it will not stick to the block on the top. It'll stick to it on the bottom down here, and we put this on and kind of press it down, and all you need is acrylic on the occlusal surface. You don't need to wrap it around the sides of the teeth at all. Just have it on the occlusal surface of the teeth. And now you'll come in, and you have already practiced with this person, but we put it down, and now you take something here to hold it, and this is number 12 Bard Parker blade, and we just cut it off on the sides. We take it off and just have the part that's right on the occlusal surface. And now we have practiced with that person where we're going to close too. Like if you want to close where the jaw is comfortable, and you'll go to that spot and you mark it on the teeth with a little marking pencil, and you put that and just let the person close a little bit in there, and then that'll let it set up in that position. Now you can open it now, and it's still soft enough where you can trim some of that material off. So now we grab this and we come in with that Bard Parker and trim the little excess off where there's nothing on the lingual of the tooth except that. And you can go on the buccal and the lingual of the tooth and cut that with a Bard Parker. This hasn't set yet, but it's fairly solid, and we've bitten down a little bit in here, and we're going to come back. Now we take that acrylic and get it out. Now you have the person bite down again and go back and make sure you don't have any interference with the acrylic on any part of the braces you've got on there. Or we can trim it some more and then trim the back of it off if you want to, and then have the person close to the right position you want, and then hold it there until this sets up. Now when the person opens, the lower jaw will just go away from the upper jaw, and this will not stick to these teeth, but it sticks on to the bottom teeth down here. And when we take it out, we've got the imprints of the teeth on the acrylic. And now we take a burr, kind of a barrel burr, and this is set up now, it's hard. And we're going to trim this down to where we just have the spots where the cusp come together down here. So the height is the same. And then we're going to make one on the other side and let the person bite on this, and whatever comes down on the other side will be if we're going to do this on both sides of the mouth. All right, we grind that away, and that's, all right, let's see. And that is the way we build a bonded block in somebody's mouth. Now, the bonded blocks, let me see if I can go back here and see. I'm going to push this up and go back through these again just a little bit. Try this if you haven't used these bonded blocks, and let me explain some of the things. If you put a block over one side of the mouth to catch a crossbite, something in the front part of the mouth here, and you don't put anything over here, you leave this alone about two and a half months, something like that, and these teeth will come together. It is marvelous how the body reacts to this. It'll close teeth where you'll be chewing over here. Then when you get your tooth through the gap, you have the person bite down, you have got the tooth through, then you take this bonded block off. Now the way we take them off, I don't have that marked out here, but we take that same barrel burr and we just come right down through the middle of this thing and trim that tissue off right there. Let me get this back over here and I'll show you how we. Now, you take this burr and you just go right down the middle of this. In other words, your block is setting up something like this, and your teeth are up in underneath here, and you cut a trough through this. The color of this acrylic and the color of the teeth is different. And when you get close to the teeth, you stop. And you can see the teeth, and then you get a suction there picking up this stuff. Now, once you cut this groove down from one end of it to the other, you catch with a pair of pliers here, and you mash together, and one side of this will come loose. It'll come loose. You're not bonding it with something that really sticks on there. It'll come loose, and you take it out, then you catch the other one and put some force on it, and it'll come loose also, and just take it off, and you've got the thing cleared up. And that's the way we take the blocks off. We know how to take them, to put them on there. Don't put them on where you can't take them off. And so just use the regular acrylic, bond it onto the occlusal surface only. Don't go wrapping them around the teeth like that, so they'll come off. And then you can pull that right out of the mouth. Now, if you haven't used those things, it is marvelous what you can do with these blocks. We put them down on the back teeth and put in, like if you want to open the bite, the dental bite, you can have somebody close and you go to open it, and you put blocks back in the back, and you have your intruding wires, and you raise you have a gap in there about 2 to 3 millimeters, and the person chews on that, and they chew so much on it that you can pick these teeth up and intrude them into the bone and not increase the vertical dimension of the face at all. In fact, you can reduce it some if you just bite on these things. And if you think you don't bite on them, you put some of these on your own mouth and you'll bite down so much, and you use the muscle structure to keep the mouth from getting higher angled in here. That looks bad. You have too much of this vertical dimension of the face. So to get rid of that, we put the blocks in the back on cases we don't want to open. If we want to open them, we put something up in the front, and these teeth don't touch anything, and we put that force on them to intrude the teeth, and they erupt up, and then you get more vertical dimension of the face if you want to bring it up, so you can juggle the length of the lower third of the face around by using these blocks in doing your work. So I'm going to hush and get on, and I hope you got something from this, and you'll join our group and subscribe to our videos. So thank you for watching, and I'm going to go ahead and close this out. Bye-bye.